You know that feeling at the end of a long, hard week when you finally sit down, maybe with friends or your partner, and you pour that glass of wine or crack open a cold beer, and you feel that immediate wave of relaxation wash over you? And it's a ritual that feels so human, so earned, and honestly deeply personal to so many of us, including myself. But if you have felt a subtle shift in the air recently, or noticed that the advice from your doctor or the headlines in your news feed have started to sound different, you are not imagining it, because 2026 marks the year where the safe ground we thought we were standing on has fundamentally moved. Before we dive into exactly what is happening to your body and why the rules just changed, I'd love for you to hit that subscribe button and join our community here because we are navigating this new era of health together, and I want you to have the most accurate, science-backed tools to protect yourself and your family. I want to be crystal clear with you right now that everything I am about to share is not my opinion, nor is it about judgment or telling you how to live your life, but rather it is strictly based on the brand new 2025 2030 U.S. Dietary Guidelines released this January alongside data from the World Health Organization and peer-reviewed studies from Nature and the Lancet. You can find every single source listed in the description below so you can verify this for yourself because you deserve the raw truth. For decades, we operated under a very specific set of numbers that became almost like a social contract: 2 drinks a day for men, one for women. And we were told that as long as we stayed under that limit, we were safe, or maybe even helping our hearts. But on January 7th, 2026, the USDA and HHS released the new dietary guidelines for Americans. And for the first time, that safety net of specific numbers has been stripped away in favor of a much starker, vaguer warning: consume less alcohol for better overall health. It sounds simple, but the removal of that safe daily allowance is a massive signal that the scientific consensus has tipped. And we need to understand that this isn't just bureaucratic wording. It is an admission that the biology of alcohol is far more complex than we wanted to believe. This timeline really puts it into perspective because we have gone from permission to caution in a single generation. And the reason for this pivot isn't that politics changed, but that our imaging technology got better. We used to look at the liver as the main victim of alcohol, but new MRI studies, specifically a landmark paper in Nature Communications, allowed researchers to look at the brains of over 36,000 adults. And what they found was startling because it wasn't just heavy drinkers who showed damage. They found that in 50-year-olds, going from just one alcohol unit a day, that as half a beer to 2 units was associated with changes in the brain equivalent to aging 2 years. When you look at that data, you realize that the curve isn't a straight line. It accelerates, meaning that the difference between 1 drink and 2 drinks isn't just double the risk. It's actually a much steeper climb in terms of brain age. And this happens because alcohol, or ethanol, is a small molecule that passes through every membrane in your body. So it goes into the brain, the liver, the heart, and the breast tissue, and your body has to metabolize it into a substance called acetaldehyde. Acetaldehyde is the real villain in this story because it damages your DNA and prevents your cells from repairing that damage, which is essentially the biological recipe for cancer. This is why the World Health Organization has classified alcohol as a Group 1 carcinogen, putting it in the same category as asbestos and tobacco, which sounds terrifying and extreme. I know, but it is important to separate the hazard from the risk. The hazard is that it can cause cancer, and the risk depends on how much you drink. But what the new 2026 guidelines are acknowledging is that we can no longer say the risk is zero. We now have solid evidence linking alcohol to 7 distinct types of cancer, including breast cancer in women, where even light consumption, about 1 drink a day, can increase the risk by roughly 13 to 15%. You might be wondering, Doc, what about all those studies that said a glass of red wine is good for my heart? And this is where the most fascinating piece of scientific detective work comes in, something researchers call the sick quitter bias. For years, studies compared moderate drinkers to non-drinkers and found that the moderate drinkers lived longer, but they missed a crucial detail. The non-drinker group included people who had quit drinking because they were already sick, elderly, or disabled. So, moderate drinkers weren't necessarily healthier because of the alcohol, and they just looked healthier because they were being compared to people who were already fighting serious illnesses. Once researchers corrected for this bias and removed the sick quitters from the data, the protective benefits of alcohol for the heart largely disappeared, leaving us with a much clearer, albeit more sobering, picture of reality. This is why you are seeing countries like Canada changing their guidance to say that 2 drinks a week is the low risk threshold, and why Ireland is fighting to put cancer warning labels on alcohol bottles. It's similar to what we see on cigarettes, although that has been delayed until at least 2028 due to massive industry pressure. I know this information can feel heavy and it might even feel like something you enjoy is being taken away from you. But I want to reframe this not as a restriction, but as empowerment. The goal of these new guidelines isn't to scare you into never having a toast at a wedding or a beer at a barbecue, but to give you the agency to make choices based on facts rather than marketing or outdated science. If you choose to drink, you now know that less is better, and you can make that trade-off consciously, knowing exactly how it affects your brain and your body. So, as we move through 2026, let's use this knowledge to take care of ourselves and each other, perhaps by exploring the incredible new world of non-alcoholic alternatives, or simply by savoring that drink a little more. Slowly and a little less often, knowledge is the best medicine I can prescribe. So take this information, verify it with the sources below, and make the choice that is right for your long, healthy life.